And now let's go to our KSAT Q&A. Yes, my friends, it is Mental Health Awareness Month, and now more than ever, it's important to focus on this issue because so many people we know are in pain. Experts say that more teens, Black and Hispanic males and females are committing suicide. So here's the question. How can we help? And today we're going to have somebody who can shed light on that and more. We have Dr. Christine Eumutier joining us. She is the Chief Medical Officer with the American Foundation for Suicide Prevention. Dr. Moutier, thanks for sharing some time with us today. I think when it comes to all of those different groups that Stephanie had just mentioned, the rates of young people wrapped up in anxiety, depression, self-harm, suicide, that is incredibly alarming because that number is growing. So are there certain factors that you're seeing when it comes to what's driving more teens to feel so trapped in some ways?
We all have mental health to manage all of the time, but this has been a time, right, for all of us where uncertainty, feelings of isolation, and now coming out of the pandemic or our next phase, there's just a lot going on for different people, for different youth. And look, for people who have any vulnerabilities towards depression, anxiety, a history of trauma, it can just really press upon the mental health and suffering of those individuals. So it really is a time like never before to learn how to have these more authentic conversations where we can check in with one another and really hear what's going on. Allow them to talk. Even just talking alone helps so much, let alone connecting to professional sources of help when necessary.
Now, do you think it's just interesting that right next to you, we're showing pictures of people on their cell phones while we're talking about this? Can you draw a parallel or can you explain how the pandemic affected this or what impact? Because we understand mental health experts are still trying to understand the impact that had on so many people. But what have we seen so far?
Well, right now, our latest CDC data tells us that 4 in 10 young people are talking about having experienced persistent sadness or hopelessness during the pandemic. And that is a higher level of, rates of those kinds of distressing experiences than pre-pandemic. And we do think that already there have been increasing rates of depression and anxiety. Now, screen time is a factor. We know that. And it's kind of a double-edged sword because it can be a source of connection. And some people are really actually sharing and receiving support for their mental health experiences, but others are not. And the general feeling is that spending a lot of time on the screen time, which got accentuated during the pandemic, if you think about it, for all of us, let alone for our youth, that was in place of the usual protective kinds of activities like in-person school, in-person sports, supportive kind of connected experiences that young people and adults would have on a normal basis. So there's a whole lot of factors, financial strain, loss, the uncertainty and fears about the impact of COVID or, various family circumstances. So there are many different factors. If you look at a societal level, increased rates of substance abuse, increased rates of purchasing new firearms into the home. There are a whole lot of factors that can affect the suicide risk of a population. But again, don't think that we are without the ability to protect our youth and protect each other just by checking in and opening up that open dialogue.
And I think part of that is certainly knowing what to look for, right? I mean, when it comes to teenagers especially, there are a lot of big emotions during those years. And so I'm curious if you have any advice for parents on what to look for to say, okay, this is something different than what people may chalk up to normal teen behavior. When are there signs of a problem?
I'm so glad you're asking this because for a long time, I've been noticing that we write off too many signs of deteriorations in mental health to kind of normal teenage angst. And the truth is, while it's a time of change and transition, and the brain is developing, actually all the way through the early 20s, the brain is still physiologically developing. But what I would say is, if there are signs and expressions outside your child's usual patterns of behavior, and I know that's a really broad definition, but trust your gut instinct. If they are seeming withdrawn, their tone of voice is more, hopeless. They're talking in terms of feeling like they're a burden to others, feeling overwhelmed, and not bouncing back. I mean, increases in substance use, certainly drinking, drug use, but also aggression and feeling more irritated, more easily angered. If there are signs that their academics are deteriorating, their coach calls you and says, they're not acting like themselves, something is different. I would pay attention to all of that. And most of all, pay attention to your gut and rely on the other adults in your child's life to check in with them. But most importantly, try to open up that open dialogue in the home environment. I know it's not easy as parents, but really letting them know that you want to understand what their experiences are and be quiet enough so that they have space to talk about that.
So let's also talk about treatment. Where do you start that? What's the first number that parents can call to seek treatment, counseling, things like that?
Yes. If you are not already connected to any mental health professionals, that is completely okay. You can always start with your pediatrician, and they will tell you who they've, been referring to in the community and who they have good experience with. If you have insurance, you can certainly start by calling your insurance or checking on the website and, putting in mental health professionals and put in a radius that you're willing to drive and be ready to make some phone calls and really vet. If you have the kind of friendships and network within your community where you are able to talk about mental health, which is certainly happening more and more amongst workplaces and friend groups, then that's another place where we talk to each other about, who we should go to for this, that, and other types of health conditions. And mental health is no different.
Okay, Dr. Christine Eumutier. She is the Chief Medical Officer with the American Foundation for Suicide Prevention. Thank you so much for your insight today. We appreciate it.
Thank you for highlighting this important issue.
Absolutely.
Appreciate it.